Tracy, you should have the link now.
Okay, I'm just waiting on it to come through.
No problem.
There it is. All right, let me just go check to verify. Okay, you're good to go.
Thank you.
You're welcome.
Right. Amy, I know, let me
Wait,
check my,
I see Glenn now. Is there anybody? I think we have everyone, huh?
I was just going to find my thing with who was gonna be late today, who told me they were gonna be late, was Kelly Brandon won't be arriving until 10:45, so we're not expecting her yet.
Okay.
And Kathleen thought she'd be late, but I think she's here.
I'm here. I'm here.
All right, thanks, Kathleen.
Ingrid, you're good to start your meeting whenever you're ready.
Very good. Let me get my script here. Good morning, everyone. A meeting of the Louisiana State Board of Medical Examiners Occupational Therapy Advisory Committee pursuant to lawful notice is duly convened and called to order at 10:06 a.m. Friday, April 12th, 2024 via Zoom virtual video. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Olivia, or I don't know if I should ask Olivia or Patricia, please confirm that you have verified the identity of all tele and video conference participants.
Yes, ma'am, I have.
Is the sound clear and audible to the public and those on the tele and video conference?
Yes.
All additions to the executive or public agenda must be made presently, as we will no longer make additions to the agenda after the close of the public session. I'm now going to review the mission. The mission of the Occupational Therapy Advisory Committee is ultimately to protect the public, i.e. the consumers of occupational therapy, by regulating competent practice and upholding the standard set forth by the governing rules and regulations. I'm going to do the roll call now. Members present are as follows: Amy Lariviere, Kim Solari, Kathleen Norcross, Carolyn Murphy, Ingrid Frank, Glenn Wallace, Raylena Crook, Mary Green Keys. Did I get everybody? Did I miss anybody? Amy, could you confirm that we have a quorum?
We do.
Okay. And also present at the meeting are Patricia Wilton, LSBME Executive Counsel, Lauren Suttereth, also LSBME Attorney, Olivia Palong, LSBME Executive Program Specialist, Tracy Morrow, IT Specialist, and Phyllis Johnson, Licensing Analyst Supervisor.
And also Sandra Hawkins.
Oh, Sandra Hawkins, I'm sorry. Thank you, Sandra. Sandra Hawkins, licensed analyst. Before we get to I'd like to propose that after we approve the minutes from last month's meeting, that we take a 30-minute recess, lunch break in order to and to review the rules. Do I have to vote on that, Patricia? Do we have to have a motion to take the recess?
I mean, technically, as the board, as the committee chair, you can order that, but if you could just ask if anyone is opposed to that or has a problem with that.
Is anybody opposed to taking a 30-minute recess after we approve the minutes from last month's meeting? Okay, then we will be doing that. So, our first order of business then is to approve minutes from March 8th, 2024. See, I think we'd have to, I can share the screen with, hopefully, if I can find the right screen. That has. I might have to.
Ingrid, I can do it for you if you need.
That'd be great. Yeah, I can't find what I need.
No worries. Give me just a second. Sorry, I also have a billion things on my screen.
I feel your pain.
Wait, I might have just found it. See if this is the right one.
Yep, I think so. That's it. There we go. All right, so this is our meeting from last month. You can scroll down, Olivia. Let's see, we covered dry needling. We had reviewed the minutes. Marie McLaughlin, we discussed about the process for this whole thing of changing the rules. And we got an update from Dr. Collada about the interstate compact license. By the way, I was able to meet with people at AOTA about that, and that's all exactly what's going on with, I mean, not that I question what Dr. Collada said, but it is going to be 20 months before the compact is active, exactly like he said. And then we adjourn. So are there any, and can I get a motion to approve the minutes from March 8th?
Motion to approve.
Okay, any second? Okay, thank you. Any public comment? Okay, all in favor? Say aye.
Aye.
Any opposed? All right, the minutes have been approved.
I'm sorry, who seconded? My dog started to bark. I'm sorry.
Kim.
All right, so it is currently 10.
Ingrid, can I interrupt you real quick?
Absolutely.
So just to make sure I understand, so you wanted to take a break to go kind of for the rules, but did you want to go over the other two topics that you have to discuss, or are you going to do that after you discuss the rules?
My priority is the rules, so
Okay.
I didn't want to go ahead and do that. If we run out of time for other things, we might have to table other things because our priority needs to be the rules.
Okay, no worries.
So, it is currently 2:13, so we will, 10:13, excuse me, we'll take, a recess and reconvene at 10:45. And I'll see you all back here then.
I'm assuming we just stay logged in.
Yeah,
Yeah, I'm not gonna log out. You could just turn your camera and your mic off if you like. If you prefer to hop off altogether because you need your phone or whatever, feel free.
Okay, I'll just mute and go off. Thank you.
It's 10:46. I was just able to finish, but does anybody need more time or are we ready to reconvene?
I am not quite finished, but we'll just go with the consensus.
Anybody else need more time?
I was able to finish as well, Ingrid.
Well, we will go ahead and get started, I think, then. Did Kelly join the meeting by any chance? No. Okay.
So she's still absent. And then also Dr. Van and Jacinta is absent, correct?
Right. Dr. Van is out on a personal matter, and Jacinta and Olivia is handling the call.
Okay. Okay, I just wanted to make sure because sometimes it's like just a different word and I wasn't sure.
Yep.
Thank-
Okay, I'm just sending an email that just letting Kelly, I guess, is on some sort of other meeting, but she wanted to know. So I've just sent her a thing saying we're reconvening now. All right, very good. So we'll just go page by page, okay? I guess on page one, Patricia, the only thing I see, there's still a lot of actual dollar amounts, and I did think that we had talked about removing all dollar amounts.
Okay. I wasn't sure because the last draft that I had still had dollar amounts, so I will remove those.
Okay, that would have been my bad, yeah. Does anybody else remember differently, or aren't y'all pretty sure we were gonna remove all dollar amounts? Okay.
Can we put these up so we can see
Oh,
where we
yeah.
are? Is that
Yes.
possible?
I do, I have them, yes, great idea, thank you, Kim. I do have them, let me just find it. Yes, I'm looking at the right thing, right? Yeah, here we are. Okay, so we are on page one and we just finished talking about these dollar amounts. Anything else on page one for anybody? So page two, I did not have any issues there. Nobody else either, okay. Nor page three either. I didn't have anything there either. Just unmute if you've got anything. Okay, moving on to page four. So I can make sure that, on page four,
Oh, sorry.
I was thinking that we should remove OTPF4, the number.
Yes.
You agree, yeah, because that's gonna always change every 5 years. So Patricia, I'll just highlight it. I don't
Okay.
think this is a minor thing, but just this number 4 here.
Just the number 4. Okay.
Yeah, we would want to get rid of that.
Very good.
Anything else on page 4? So page
Is that the page that has the consultation or screening definition on it? I know that we're right around there.
Yes, it's at the
I had-
bottom. It was at the very bottom.
Okay.
am I not sharing the screen? Y'all can't see it?
I can, Kim can.
Okay.
Sorry, I'm having to I have to use my phone, so it's a little harder for me to see. That's why I asked.
Okay, yes, screen is at the very bottom. It says process of reviewing available data, observing or administering screening instruments to identify a person's need for further assessment.
I wanted to just ask, do we need to have a separate sentence either in one of those terms or in both where it talks about like to make a disclaimer that like a prescription is not needed to perform a consultation, or a prescription for occupational therapy services is not needed to perform a screening? Or is that later in the, I was reading through it and I didn't really see where that specific statement was made. So I'm just curious.
Well, let's definitely write that down. And when we get to the section about evaluation, we're gonna look for whether or not we clarify that a physician, a referral is not needed for screening.
And when we talk about these things, I know that like we kind of have the idea of what we mean when we mean a consultation or a screening. I think it, and this is just an idea, I don't know why I didn't think about this sooner, but a screening typically is between like from OTP to client, and the consultation is typically like from OTP to like other providers, or and it reads that way, but maybe if there was like somebody could help me with the language, but that might also be something that could be beneficial to kind of help set the two apart, because they do seem kind of similar, you know. Anyways, it was just an idea. I'm not trying to like complicate things right now, but that was kind of like my main thought that I was thinking between as we were reestablishing what these definitions are.
Yeah, because a consultation also would not require a physician referral. Is that what you're trying to say?
Right. Neither
Right.
do.
Neither do, and you want to make sure that that's clear somewhere. Okay, got it. Let's make sure that as we scroll through the whole document. Good idea. Okay. All right, now we're on
Next page.
the one, yeah, the next page. Oh, well, that's OTP. We already got that. Okay. Now we're on the
So
next.
I have a question, this is Kim, on temporary license. Are we saying license or permit?
Yeah.
Oh, we are saying permit. I missed that. My bad. I sure did miss that.
And the other piece here too, Patricia, is that this makes it sound like the only people who can get a temp license are folks who are already in good standing in another jurisdiction. Whereas when we get to the actual temp licensing section, we do allow, temp permitting, we do allow temp permitting for someone who has completed the education but is still waiting for the results of their board exam. And so that I didn't think this definition encompassed.
Okay. And that is the definition I took straight from the draft that was sent to me, but we'll
Sorry,
make a note.
sorry.
That's okay.
That's why we're going through it, because believe me.
Yeah, of course. Yes, when we get to, we'll put a star. I'm putting a star right there. And so when we get to the temporary permit section, we can pull that sentence back out and graft it onto this.
Okay. Anything else from this page?
Yeah, I'm not sure if we need it or not, but where the definition of volunteer, even though it says volunteers do not provide skilled OT services, but perform specifically delegated client and non-client related tasks. Do we need to say a specifically delegated non-skilled? I mean, I don't know if it's redundant or if I just am reading it wrong. Do not provide skills.
Oh, but do not provide skilled OT services, but perform, you wanted to add specifically delegated, non-skilled client and non-client related tasks.
I don't know. Do we need it?
Are you saying we could just stop it after OT services? Carolyn?
No, I mean, I wasn't, I was just saying do we need to put the word non-skilled right there next to client, because I think I'm just reading too much into it.
I guess we did it this way because we had said that they do not provide.
Right, yeah. That's okay. I'm just, like I
You can
said, I
close the
think,
loop. You can close the loop. I like fewer words rather than more, but you can close the loop and just put non-skilled right there. Put N-O-N, 3 more letters. I can live with that.
All right, next page. I did not see anything on this page.
I have something on this page.
Okay.
So number 6 to me sounds like that everybody has to. Nope, I missed the very bottom. It's a non-native English speaker. Sorry, I missed that part of it.
All right.
And the other thing is, and this is just minutia, but like under 1909A, so that says board, we're using the board with capital letters, but then other
Yeah,
places we
I've got to, yeah, it needs to be all lowercase. I went through and
Okay.
tried to find and replace all those. I didn't do that.
Okay, I'm just wondering.
Yep, no, you're exactly right.
Anything else on this page? All right, on the next page here, I did not have anything, but that doesn't mean somebody else. Anybody find anything here? Okay. Moving on to the next page. I didn't have anything on this page. Did somebody find something that we need to talk about here? Okay, moving on.
Just wait, this is the part where it talks about the temporary
Oh,
permit.
yeah.
Permit.
There is. Yep. Okay. Let's see where we talk about.
Yeah, there it is.
Yeah. Would this language, Patricia, be added to the definition?
Let's see.
This thing
Yeah,
about
or an applicant. Start at to an applicant. Highlight that. Copy that. To an applicant who,
yeah.
and then go through exam results.
And go back to the definitions.
Yeah, copy and paste that back to the definition and let's see how it flows.
Okay. Too far.
Temporary permit, an applicant who is currently and meets the requirements may obtain. Yeah, and then why don't you put just paste that sentence, that next sentence, you could put capitalize the A and it'll say an applicant who something or other.
Let me just put it here and then I'll
Yeah.
see what goes. So an applicant who is currently licensed in good standing to practice in another jurisdiction and meets the requirements for endorsement, or an applicant who has completed this.
Yes.
And don't we still under the underlined parts need to say permit versus temporary?
Yes, we will. Yes,
Right,
yes.
all right.
Meets by endorsement. Or an applicant who has completed the academic specified under this what may obtain a temporary license while this is being. I hate it when this little control thing shows up.
I know.
I don't know what to do with that thing.
Okay. So, all being processed. But I feel like this is for by the board. So this extra word, get rid of that.
Perfect.
Okay. All right, we're going back down to where we were. Under temporary subject.
Okay, back up. Yeah.
Yep. Okay, so we just finished this page with subchapter E about the temp. So now we're on to this page here, is still about temporary permitting. Did anybody have anything for this page?
The only thing I saw, and I don't know, I tried to just scan back. I didn't search the document, but right there under 1939B where it says OTPs, is that the first time that that abbreviation is used? It may be using the definitions, but I didn't have time to scan back that far.
I think it is in the definitions and it says it's either or. I know it is because I had to change the way it read. It is in the definitions, but I don't think we use the acronym any other time, just the initials.
Yeah, I think I've saw OTP a lot, which is good. Okay, so if we have that defined in the definitions, that's good. All right, anything else for this page?
Hang on, I'm looking back in the. Okay, so occupational therapy practitioners in there, and it has a definition.
So I just need to add parentheses OTP close parent.
Right, yeah.
I'll do that.
Okay. So now we're on to the page at the top of it says expiration of license. Did anybody have anything for this page? Okay. Moving on to the next page. Use of title of doctors towards the top of that one. That was a lot of new things. Did anybody have anything with that page?
I do.
Okay.
Okay. 1959A just seems a little contradictory where it says shall comprise 9 members who shall be occupational therapists. One should be an OT assistant. So to me, that contradicts itself, like 9 members who are OTs and one's an OTA. So I don't know.
8 of whom should be occupational therapists and 1 who should be an occupational therapy assistant. I
agree with this 100%. It does feel wonky. Well,
one of whom should be
wanted to say should instead of shall with but that is definitely, we did discuss it, we did vote on it, that we wanted the OTA wording to be should.
Yeah, we need to, but we need to, unless should be an occupational therapy assistant unless no
Candidate.
OTA seeks appointment.
Okay.
And then I would put a period there, yeah, and period, and then say, members shall be licensed by the board and practicing. Make a new sentence, yeah.
Okay, I have one more thing. Where it says, more particularly if of one licensed occupational therapist proficient in, Should that say occupational therapy practitioner proficient in?
So
You see what I'm saying? Like, because if we have
oh, yeah, yeah,
a,
yeah,
a
yeah, yeah,
coda,
yes,
One of
yes,
these
yes.
might be, right, one of these might be the practice area.
Agreed.
and on number 7,
Oh, yeah, we got an and before we
we
need
have
it.
an
Fair
and.
enough. Thank you. I didn't catch that.
Very good. That sounds a lot better. Okay. So now we're on to the next page of, starting at the top over there should be. Lost my-
I have something on that one.
Okay,
I might be wrong, so Patricia, help me here. On B, 1961B, it says A2 and 6. Should that 6 be a 7? Talk about confidentiality.
Really, we honestly, yeah, okay. Advise and assist. Sure. Yeah. Yes. Sorry.
7.
Yes, please.
Small but good catch.
I know, man, that's some attention to detail. Woo!
We're on subchapter H now about continuing professional education. Any issues on this page?
On 1967, on the line A,
Got an extra A, yeah.
have an extra A, yeah.
There's an extra A.
Rules AA program.
I want to wash some blueberries.
See what y'all.
Do you want
First
to-
sentence of
want me to
A,
read?
under these rules, AA program shall be
Oh,
a duplicate letter, word, whatever. First,
to be acceptable. Oh, right there.
yeah. You would think the wavy red line should have tipped me off, huh?
Okay, then I mean, this is just a little thing here, but field work here is one word, but somewhere else in the document it's 2 words. So I don't know if it matters at all.
Which word?
The word field work.
Field work, yeah. I think it's appropriate to have it as 2 words. Do you agree, Carolyn?
I think the
Or how do y'all do it with the in your nationals?
Just one.
just
Okay.
one word.
All right, I'll make it 1 word there. Thanks. Or I'll find and replace anywhere it says
Okay.
that. Make sure it's
Just to
1 word.
interrupt really quick, Kelly, can you hear me?
Yes,
Okay, I just wanted to make sure you're on. I'm gonna just change it.
thank you.
You're
All right.
welcome.
Kelly's on now. Very good. Welcome, Kelly. We are on in the section of continuing professional education requirements. And we just finished this section, I think. Unless anybody else has anything else about the fieldwork section or this page. This next page. I did see a spelling error in number 1975, although that's probably now on the following page. Before I go down, then I'll just stick here if there was anybody else had anything for this page. Under 1975, the word must was missing the S. 1975B, right here, applicant must, I'm just gonna add an F.
Thank you.
So anything on this page?
Well, I copied it the way it was sent, but are y'all comfortable with current NBCOT certificate?
That kind of sounded weird to me.
Yeah.
Yeah, huh, you're right. The applicant is currently certified by the NBCOT as demonstrated by a current NBCOT certificate. The word certification feels like it's
Yeah.
Yeah.
not.
That was one of my questions. Is this, I'm sorry, I'm trying to look at this on my phone at the same time, but is this for a renewal?
Yes.
This section is, yep, renewal.
Okay, because they don't have to be current, right?
No, this is for someone who is renewing, who missed their 60-day late renewal window and went longer than 60 days.
Okay, so they need to be, they need to
Licensing.
renew. So they need to renew their certification as well.
No, if you renew your license every year like you're supposed to, you do not have to be NBCOT certified.
Okay.
However, if you if you let it expire, you don't renew within 60 days after it expires, then one of the things we need in order to renew you is the NBCOT certification.
Is that just like the equivalent of a letter of good standing? Like if you have it from the NBCOT, you get it once, but you can ask them to confirm that you have it on a particular date, or do they have to go through some other kind of process to get a new one?
If they've let that lapse too, if they've let their NBCOT lapse, then
They don't qualify at all.
right.
Okay.
We have.
So it's possible that they could have continued to have a current NBCOT certificate and just messed up on the dates getting back to renew their Louisiana license. And so all they have to do is just prove that that's current. Okay, that's cool. Yeah. But we don't need certification.
Yeah, we don't need this word right here.
Okay. So we don't require that they have a certification unless they're late, and then they would need to go back to NBCOT and go through the recertification process through NBCOT, and then they can qualify for a late renewal with LSBME.
That's exactly right.
Okay.
Lynn, is someone muting yourself? Thank you. Yeah, that's exactly right. That's exactly what we had just agreed on. And so OTs in Louisiana should maintain their NBCOT in case they screw up their licensing.
Oh, I agree.
Okay, let's see. We're still here on this page. Any other issues on this page?
Let's see, what page is that? 15?
Yeah, what page are we on?
15.
Okay.
Okay, yeah.
This word
No,
looks-
I have something on 16.
This looks like it's missing a space. I don't know, maybe it wasn't.
It's the formatting from coming over from the dual columns. I'll fix that.
Okay. Okay. All right, so now we're moving on to B, standards of practice.
There's some kind of like noise. I can't.
Glenn, is that you? Is somebody's, are you, I'm only saying that because it sounds like a male voice.
No, it's not me, but
That's
it sounds
not
like
me.
somebody's
I'm
making a
sorry.
salad that sounds really yummy.
I can't hear what it is.
I'm so sorry.
It was me. I thought I was on mute. I am making a salad for the thing I have to go to. So.
I'm sorry I threw you under the bus on that, Glenn.
That's it.
It's okay. I'm used to
I asked her
being
if
one
she was
of the
muted
only
when I
guys in a
came
room.
Okay, on this page, I do have something. On 4909D, should the word refers be refer?
I got the same thing, yeah.
Okay. And on that same one, I don't know. I read it and reread it, but that where it says by the expertise of other professional or services,
You're right, that doesn't feel right.
something's not right. I can't make it sound right in my head.
Invitations for refer. Professionals of other professionals or services.
Well, I
Is that-
think, is the distinction supposed to be they need somebody besides an occupational therapist, in which case it would be another specialty or something? I mean, what word would,
by the expertise of other health professionals or just professionals or services.
Yeah, I think professionals might get it.
okay.
Yeah. Just add an S there. Do you want me to highlight if I do something like that?
No, you're good. You're good. We've got a record of it.
All right.
I mean, I'm making notes and also we have a record. Unless that was directed to somebody besides me.
No, it was directed to you, yeah.
Okay, cool.
Okay, anything else on this page? Okay, we're moving on to the next page. Anything here? Right. Next page. Anything here? Now, next page.
That's as far as I got. I have no more comments.
Anybody else have anything with this page? Okay. Next page about service competency. Nothing there? Sure. Either.
And these are all the ones that you all essentially created out of your own expertise. These are all brand new. And I think y'all had a pretty robust debate about those. If there are, any typos or formatting mistakes, I can fix those. But the substance, I'm pretty sure you all.
Under F, under the direct supervision related task, that's a period, I think.
Oh, it sure is. Yep.
So wait, we don't want the period read, correct? Take it away.
Related task at all times.
Okay, so take the period away.
Correct.
Good catch. Now we're on to the dry needling section. Anyone see anything here? Okay. Now we're on the section about unauthorized practice. Looks as if we mostly changed things like his, her to their on this section. Okay, and now we're on our last page. Anything here? No? Okay, wow. So Patricia, with these minor edits that we made, I mean, we can just sort of vote to accept these with the minor edits that we made, correct?
Correct. And then request or instruct me to present them to the board at its meeting on the 22nd for their approval to promulgate.
Oh my gosh, that's a lot of words. Hold on.
Well, this is the work right here, but
Uh,
the rest of it just kind of rolls out. The rest of it's just time consuming, but not hard.
Okay, so I'm going to ask for someone to motion to accept these revised rules with the edits that were just made. Can I get someone to motion to accept them?
I'll make a motion to accept these rules.
All right, and a second.
I'll second Amy.
Is there any public comment?
No, we haven't received any public comment.
Okay. All in favor of accepting the revised rules with the edits we made just now today, say aye.
Aye.
Aye. Any opposed? All right, it is passed, and I will now direct Patricia Wilton.
Woohoo!
Hey,
Yeah.
Kathleen got kicked out and she needs to get back in.
We'll see.
Olivia, you on that?
He's in now.
Okay.
Yay, poor Kathleen.
We should have
like
called,
that.
we should have called Darby and told her to sit in on this one.
I
Sorry,
know.
I did.
You're right.
Sorry.
I should have.
I'm so
Good.
sorry. I text Carolyn and then I emailed you and then I emailed Olivia and I was like, I got kicked out. Nobody let me back in.
All right, the Occupational Therapy Advisory Committee asks that Patricia Wilton present these revised rules to the board for promulgation.
I will, and I will email you all after the meeting on the Monday, the 22nd, and let you know.
All right. Yay. Good job, everybody. Before I move on with the agenda, I need to save this. Hold on.
That's April 22nd, correct?
Yes, a week from Monday.
Thank you.
You're very welcome.
Okay, I saved that. All right, I'm going to share the screen again with the agenda. Yes, I think I am. Oh, I think I. There we go. All right, our next order of business actually was added by Dr. Van, and I'm not sure, with him not here, I'm not sure if unless Patricia or Olivia knows anything about the telemedicine that got added. I did not add this. I'm not sure what this is about.
I saw a reference to an email where he was speaking with a woman who evidently had asked a question. Olivia, did we get any kind of documentation or email of the question that she wanted asked
I would
answered?
say there it is. If you scroll down, Ingrid, the email is there.
It's about telemedicine.
Yes, ma'am.
Okay.
Mhm. That should be the email right there.
Wow. It's an interesting
I know.
opening line.
It's a hell of an introduction. No concrete guidance on the question. When the Louisiana licensed OT is providing evaluation and treatment via telemedicine in the rehab setting, can it be either a tech or a coder present in the room with the patient? And then she has what their folks thought the answer was. And now it's for you all too.
Okay, well, Okay. So, it's an interesting question in terms of the safety of the client during telehealth. And whether you're relying on family members or a paid person or not, or simply only doing things in which there's absolutely no risk of a fall. I doubt that our telehealth rules address anything this specific.
They
We
do
don't
not.
have any telehealth in the OT rules. We're using the LSBME's.
Correct.
Does the LSBME's telemedicine rules talk about the client's safety or security during a telemedicine visit or telehealth visit?
Not with specificity. What they say is that the practitioner needs to use the necessary medical judgment, skill, and safety in reference to the conditions. So I guess I guess you all would have to tell us, tell her if so would it be how would it work if it wasn't telemedicine? Could an OT allow a tech coda to assist with the installation and so forth?
Yes, if they were seeing the person in person, and let's say the therapist felt like they needed a second pair of hands, and they would direct the tech to assist them. If they didn't need a second pair of hands, then they wouldn't. In this case, I guess the patient's in their home and
No, it says rehab setting.
Yeah. And is using a gait belt, is that considered some level of skill that a tech does not have, or?
No, they can use gait belts.
Okay.
that's not a skilled thing, but it is. Should we ask this person for some more information about?
What more information do you think you need to be able to answer her question?
Because we're confused about why you would need telemedicine in a rehab setting.
I can tell you from some of my students that work around the country. I have a student that she has supervision from her OT and via telehealth, and she helps the OT do the evaluations by being in the room with the patient in skilled nursing areas. And maybe, I don't know if it's rehab or what, but I know that it's in a medical setting. And so she's the one in there with the patient, and the OT is evaluating via telehealth.
And that's a fieldwork student.
No, I mean, she's in our bridge program, so she's a CODA.
Oh, CODA.
So, yeah, in her practice as a CODA. So that's not in our state. So, but I'm just saying I guess that's what they, is being done some places.
So there would be a distinction of note between what you would be comfortable with a CODA doing versus what you would be comfortable with a tech doing.
Yeah. So are we to take this, Carolyn, that the OT might be offsite potentially? The tech is in the room. The OT is directing the tech on what to do and then billing OT.
That's what it's at. Yeah.
Jeez Louise.
I mean, here's my thought about it. If something happens with the tech in the room, you're evaluating the client, right? Is that what she's wanting? Evaluation?
Both.
Treatment, evaluation, treatment. Evaluation, I could see that it needed to be a CODA because of the fact that you don't really know what that skill level is of that patient. And if it's a fall, if it's any kind of, something that happens, then I would think that there would be some liability issues.
Yeah, because you're evaluating the patient, so you don't know what they can do yet.
No. Now, in treatment, I could see that maybe it would be a tech if it's if it's being directly, if the OT is there watching, but again, also, if it's skilled, why is the tech doing it? I don't know.
Our telemedicine rules say that, you should only choose telemedicine if it's not going to degrade the quality of the intervention. I think this person would just need a reminder of that too. It can't be about convenience.
Can I just say one thing?
Yes.
I don't know where the people are, but I have worked in nursing homes before in different states, and they might have a right to fall, but we didn't have text, so I don't know what the text rules are or anything like that. But the coda, like if the patient fell with you, her it not being like a true incident where you were standing them up, didn't have any help or gate belt, blah blah blah, then it would be that maybe they're thinking about the person's right to fall, because in some states there's a real rule that says it's their right to fall, so you can't have like the restraints on them or anything. So maybe that's what she's talking about in that letter, possibly.
Yeah, maybe.
I don't know. This is kind of a sticky question. I mean, I would say evaluation, it would need to be the coda for sure.
Yeah. Yes, I agree. I think though, I'll might formulate a response that includes that because the therapist does not yet know the patient, the only person that would be appropriate in the room would be a coda, not a tech, for evaluation, and that for treatment, I mean, I guess sometimes it could be appropriate that the tech is in the room, but that I'll just reiterate that in our law, that the telemedicine or telehealth choice isn't a matter of convenience, but a matter of, and cannot degrade the quality of the therapy. That's just my concern, is that this is about convenience.
Yeah.
And cost.
Do we have a rule where it says that an evaluation like that OTs can do telemed evaluations? Is that common? I mean, I don't do much telemed, but it seems like this could quickly be taken advantage of in a negative, in a negative way, to where there's really no skilled hands present with a client for the first time in order to establish care. And that's part of, the value of what we bring to the table. If we're just watching somebody on a screen and telling somebody else how to touch somebody or get them up or whatever, like, even if I could direct a tech, I mean, I've been in the room with students countless times trying to do a transfer, but I can tell them all the things I want to tell them, but unless I'm the one who was able to actually feel how much, tone or no tone the person has, if it's a recent stroke, or like, that's where all of our skills come into play. So it just seems real murky to me to start just saying, yeah, that's fine if it's a coder that does it, or whoever that does it. I guess I'd feel way more comfortable if it's a coda and they've demonstrated the service competency that we outline in the rules and regs. But I don't know. It just something about this doesn't feel right to me to just put a stamp of approval on.
I hear you. I think we probably all are concerned about that. The choice of using telehealth in this case is a more a matter of convenience than it is about actually the best thing for the patient. But do we say you cannot evaluate someone over telehealth? No, that's definitely happening. I mean, occupational therapists are evaluating a child's feeding skills over telehealth in rural areas. I mean, it's happening. it's happening, and it's most of the time appropriate.
Okay.
But
Okay.
this one, you know, we're not gonna be able to respond right away. I'm gonna have to write something up, I think, and then we're gonna have to bring it back to the next meeting for y'all to look at. And I'll have to re-review the telemedicine rules that we have, and I'll send it to Patricia first to see if it looks right from the legal point of view, and then we'll all look at it together next month and vote on it, and then send a response. Is that okay with everybody?
Good point.
I don't wanna create something right now, but
Yeah, that's good.
is everybody good with the focus of what I would talk about? Is that because in an evaluation setting, it would never be appropriate for a tech to be in the room because the therapist doesn't yet know the client or have any idea what's gonna happen. And then in a treatment setting, it's case by case, and that all the quality of the intervention has to always be considered as the primary decision behind whether or not a telehealth is appropriate.
Yeah, that sounds good.
All right, so then our next, any public comment about that issue?
No.
I'll probably find the next, email here. Yes, thank you, Olivia. She's got this all on here. This is a question from Jennifer Teague, who works in the school system. And she wanted to clarify whether or not the doctor's order has to be renewed. Let me start down here, the original email. Okay, we are a school which participates in Medicaid billing, and we're under the impression a physician's order should be renewed annually. At a meeting, I learned there's a discrepancy between the OT Practice Act and billing requirements. While Medicaid requires the MD order annually, the Practice Act requires an order to initiate service, but does not explicitly state or require renewal of that order. And that is correct. That is, we don't have that. I was advised that you may be able to provide further clarification on this matter. Specifically, I would like to know what to do in the following scenario. I receive an order for OT treatment for Johnny on 1/2023, provide services and bill Medicaid. Then 1/2024, a year later, Johnny K's doctor has not signed with a new OT referral. Can I still see him and code the visit as non-billable? Or do I need to stop seeing Johnny until he gets the updated orders? So that was the initial email. And I sent a response back saying I would have to bring this to you all and we'd get back to her. So that's me saying thanks for your inquiry. Then she emailed back. I actually don't think I saw this. I may have though. She's voicing concern about removing, trying to make sure that we have no barriers to treatment.
And I think that's what we've been trying, that we looked at for
we did already answer
new rules, yeah. But I think as it stands,
I wanted to quickly share with y'all the response we gave to a different setting back in January, and it seems to me that it would be the same response here. Oh, so many things open. Give me just a second. This is what we responded to Rachel Farnett. Can y'all see it? I'm sorry. It said we already had a similar request and this was our response. Okay. This was Rachel Farnett, who worked at Oshner Skilled Nursing Facility, I think. Asking if per the rules, do we have to get new orders every 30 days? So we responded, at this time, neither the laws nor the rules indicate a time frame. The guidelines for the referral expiration are dictated and should be consistent with standards of practice as outlined by the AOTA, payer and insurance guidelines, and institutional regulations. Do y'all think this applies basically to the school question?
Yes and no, which is an awful answer.
Okay, go.
Okay, so yes, because of the payer's guidelines, she could not bill, you know, under Medicaid without that doctor's orders. And according, I mean, I don't know because there's no specifics, but I think in terms of doctor's orders, we consider those valid for 1 year. And then after that, you're really not supposed to treat without a doctor's order. I don't.
Well, except we don't have that written down anywhere.
No, we don't.
And I doubt the AOTA does either.
Just tell her to hang on.
Rules, we really basically say that in the educational setting for
They
educational
don't need one.
they don't need one at all. So, you know, that's the way we're moving toward anyway.
I don't know. I don't know the answer to this question.
Patricia, do you have any feelings about this? I know, would this response work for that inquiry?
Well, yeah, I mean, to me, it's tripping over into us giving her specific, if you will, legal advice that she can rely on to do what she wants to do. And that's really a little bit beyond the scope of what we typically do. But I do think this answer is correct in the sense that neither the act nor the rules and regs indicate a specific time frame. So she, you know, she has to take it up with, you know, with Medicaid or whatever else.
Medicaid with her employer.
Yeah. But I think you can tweak this to make it responsive to her as the best answer we can give.
Okay. Since we've already sort of answered this question in the past and agreed as OTAC, is it okay if at this point I basically tweak this answer and it just send it to you, Patricia, and if you're okay with it, then we send it out and not have to revisit it again in a month?
If the board's if the committee's comfortable with that, I'm comfortable with that. Of course, I'll let Dr. Van look at it too, make sure he says, you know, he says that's a good idea. But yeah, I don't think you need to delay it.
I mean, this one just feels so similar to what we just did in January. That's
Right.
why. Is that okay? Does anybody have a problem with if Dr. Van and Patricia are okay with tweaking this a bit, that we just go ahead and send it out, or does anybody think it should come back to the committee again next month for a vote? This particular issue.
I think you can write it up.
Yeah, I think so too.
So for this one, because we have already kind of talked about it. All right. Let me go back to the agenda. Well, that's it. We're at the end of our meeting. Our next meeting is going to be on Friday, May 10th, 2024 at 10 o'clock in the morning. we already know that we're gonna have a response to the therapist from the skilled nursing facility on the agenda. And Patricia, in terms of the rules, being promulgated or put onto the LSBME, board meeting, does it look like that we will be on the board's April
yes.
meeting agenda?
Yes.
Could you repeat the date of that?
April 22nd.
April 22nd, and the time?
It starts at 8:30. They get to the regulatory report, depending on what else they have going, somewhere around 10-ish.
April 22nd. Okay, very good. And then I will be there to advocate for the rules changes and answer any questions, and also probably somebody from Louisiana OT Association who's more involved in dry needling or
Okay.
more knowledgeable. Do we have to present a list of persons who are going to attend ahead of time?
So
to any-
we don't know yet whether our elevator will be fixed to get to the boardroom by that time. We had a drastic flooding situation, pipe burst thing, and we have not been able to take the elevator to the 5th floor or use the elevator at all, frankly. And so our first meeting after that happened was completely by Zoom. And our second meeting after that happened was the board members met in public at the board office. But on the first floor where there was no ability for the public to be in the room with them, that the public would have has to climb 5 flights of stairs to watch it on video. So that's the short, long way of saying I have a feeling that it may be by Zoom, and if so, you all can just the relevant people can request the Zoom link and you can participate in that manner. But we can make sure that the president knows that there will be persons who wish to speak on that item when it comes up.
And they may not wish to speak about it so much as be available to answer questions or issues that the board has.
Okay.
So maybe I'll just send names and email addresses of anybody who I would like a link sent to
Okay.
Olivia.
Yeah, Olivia, that'd be great.
Okay. All right. So, and also members of OTAC, it does not need to be anybody who wants a link to be there. Just let me know, and we'll compile a list. I'm all for having more than just me. If anybody wants to attend and be there to advocate for these rules changes, obviously as chair, I will definitely be there for the duration. And I know that Jennifer Lucky from LOTA and what's the guy's name who's the hand therapist who's been working so hard on this?
Randall.
Randall, yeah, sure, he's committed to being there too. So I will email them right away, saying that we should be able to expect to be on their agenda April 22nd, 8:30 or 10 o'clock.
Have you concluded the rule changes that you plan to make? I mean, I've been kind of in and out of the meeting. Yeah, really?
We're done.
This is it. Yeah, well, I mean, I guess it's late to say it, but I mean, the analyst was asking about this term of a temporary permit. You know, like the respiratory therapists, they have in their rules that an applicant, you can apply for a permit, but within a year of graduation, you know, you have to have graduated within the past year to apply. Whereas I didn't see that addressed in the rules. So kind of too late.
We did not address that specific thing. We did not.
Yeah.
So let me think what that would mean.
So I'm trying to think of what do we
Somebody
do?
graduated and then 2 years later wanted to apply for a temporary permit. And they had
And I
not,
think it says they qualify if they have applied for but not yet taken or gotten the results, right?
that's right, it does say that.
Yeah.
And it does only last 3 months.
Yeah.
Then fall off. So I think we're safe for now, but that is we also have in these rules that we have to do a rules revision every 3 years because we didn't want it to be in another situation where we don't look at these things for 10 years. So we do have it built in now for more a frequent of the OTAC, whoever's on OTAC, of looking at the rules and ensuring that they're written.
So I guess things that we may be questioning or not quite comfortable with, I guess we can always present to the advisory committee for an opinion. Yeah.
Yeah,
Gotcha.
Absolutely.
Yeah. Okay.
But our temp permit rules are in general actually going to be tighter than they are right now. They're going to be more restrictive temp permit
Okay. Okay.
than they are currently.
Okay. Thank you.
All right, is there any public comment?
No.
No, there's.
Then our meeting is adjourned at 11:53 a.m. And thanks you all. Good job. Round of applause.
Thanks, everyone. Happy weekend.
Yes.
Thank you.
Trisha should work
You
tirelessly
too.
to get this together for us today. Thank you.
Thank you. Appreciate it.
Thank you guys. Bye.
Bye.
Thank you, Ingrid and Patricia.